Having a caesarean section can be as satisfying an experience as a normal delivery, especially when using spinal anaesthesia. Not knowing what will happen on the day may make you feel overwhelmed and worried. Today I'm going to explain what is going to happen on that day and discuss in detail your anaesthesia so you can feel more relaxed and familiar with the procedure. On the night before your surgery, you will take one of the 2 tablets that the anaesthetist will give you today. It is recommended you stop eating from midnight and only drink clear fluids up to 4 hours before the surgery. Milk or any juice with bits are considered as food. On the morning of your surgery, before coming to hospital, you will take the 2nd tablet with a sip of water. These tablets decrease the acidity of your stomach. When you arrive on the delivery suite, the midwife will check you in and show you and your birthing partner the room where you will stay until the time of the surgery. The anaesthetist will come to meet you and will be able to answer any questions you may have. The time of your surgery depends on your place on the list. Emergency deliveries will take the priority and may delay your operation. If this happens, we will keep you updated. When we are ready for your surgery, the midwife will come and guide you into the operating theatre. Your birthing partner will be able to come in with you. There you will meet the rest of the theatre team who will introduce themselves. There are many people who will be working in the operating theatre, but do not worry, this is normal. Once the routine patient checks have been completed, the anaesthetist will insert a plastic cannula or drip, most commonly in the back of your hand. The local anaesthetic that numbs the skin may sting a little. Monitoring equipment will then be attached to you to measure your blood pressure, heart rate, and the amount of oxygen in your blood. We will help position you for the insertion of the spinal anaesthetic, either sitting or lying on your side. It helps to curl your back as much as possible. The anaesthetist will spray your back with sterilising solution, which feels cold, followed by a drape to cover your back and keep the area clean. The anaesthetist will find a suitable point in the middle of the lower back and inject a little local anaesthetic to numb the skin. Again, this may sting a little. It is crucial to stay still and maintain the position as much as you can while the anaesthetist is giving you the spinal anaesthetic. You should only feel a little pressure during the insertion of the spinal needle. Sometimes you may feel a tingling sensation going down one leg, like a small electric shock. If you feel this, feel any pain, or if you feel unwell in any way, please tell your anaesthetist. When the needle is in the right place, the anaesthetist will inject local anaesthetic and a pain-relieving drug and then remove the needle. It usually just takes a few minutes, but if it is difficult to find the right spot for the needle, it may take longer. You will know when the spinal is working because your legs will begin to feel very heavy and warm. They may also start to tingle. Numbness will spread gradually up your body. The anaesthetist will check that it has reached the middle of your chest before the operation begins using a cold spray. It is sometimes necessary to change your position to make sure the anaesthetic is working well. The team will take your blood pressure on a regular basis. As soon as you have the anaesthetic, your birthing partner will be able to join you in the operating theatre until the end of the surgery. Whilst the anaesthetic is taking effect, the obstetrician will insert a tube, a urinary catheter, into your bladder to keep it empty during the operation. This should not be uncomfortable. The tube will be left in place until the next morning, so you won't need to worry about being able to pass urine. For the operation, you'll be placed on your back and tilted to the left. If you feel sick at any time, mention this to the anaesthetist. A feeling of sickness is often caused by a drop in blood pressure. The anaesthetist can give you treatment to help with this. When the spinal anaesthesia is fully working, the obstetrician will start cleaning your lower abdomen with cold cleaning fluid. You may feel pressure, pulling or tugging, but no sharp pain. Then a screen will be put up so you and your birthing partner will not see the lower part of your body or the surgery. However, if you want to watch your baby being delivered, we can put the screen a bit lower so you and your partner can enjoy that experience. Before the start of the surgery, we will check you are numb enough for the operation to begin. Your skin will be cut slightly below the bikini line. Once the operation is underway, you will hear the sound of instruments and suction of fluids from around the baby. You may feel pulling and pressure or tugging, but you should not feel pain. The anaesthetist will talk to you while the operation is happening and can give you more pain relief if needed. So at any point, if you feel uncomfortable or in pain, talk to your anaesthetist. In case you feel severe pain or in case of any complication during the surgery, your anaesthetist may need to give you a general anaesthetic very quickly that will put you to sleep. Do not worry, your anaesthetist will communicate with you all the time, telling you what is happening. From the start of the surgery, it usually takes about 10 minutes until your baby is born. Immediately after the birth, the midwife will cover the baby with a warm towel and hand the baby to you to have a cuddle and say hello. The obstetrician will take about another half an hour to complete the surgery. Afterwards, the anaesthetist or the obstetrician will inject local anaesthetic around the nerves supplying the skin where the surgical incision is. You will not feel any sharp needles, as you will still have the effect of the spinal anaesthetic. These injections will help you with the pain afterwards. In addition, if you agree, and it is safe and appropriate, you may be given a pain-relieving suppository, similar to ibuprofen, to help with the soreness when the anaesthetic wears off. After the operation, you will be taken to the recovery room for about 20 minutes, where your blood pressure will continue to be monitored. Your birthing partner and baby will usually be with you. You can begin breastfeeding if you want to. In the recovery room, your anaesthetic will gradually wear off, and you may feel a tingling and itching sensation. Within a couple of hours, you will be able to move your legs again. Spinal anaesthesia is considered the safest option for elective caesarean section, but I now need to tell you about the risks and complications that may occur with the anaesthesia. It is common for the spinal anaesthetic to cause your blood pressure to drop, and this may make you feel sick or faint. Your anaesthetist can give you medicine to treat this as soon as it happens. Also, commonly you may have some itching and shivering which lasts for about 10 minutes. Occasionally, your spinal anaesthesia may not work well enough. Your anaesthetist may repeat it or give you a general anaesthetic depending on the situation. Uncommonly, spinal anaesthesia may cause severe headache after the surgery and can rarely cause infection, blood collection or injury to the nerves around the spinal cord. The local anaesthetic injected around the surgical incision after the surgery is very safe. Rarely this can cause infection, blood collection or injury to the nerves or organs. In the event of you needing a general anaesthetic, your anaesthetist will give you oxygen before the anaesthesia. Sometimes the mask may feel tight, but it is important to give you and your baby extra oxygen before the surgery. When you wake up from the general anaesthetic, your throat may feel sore and you may feel sick or have pain. More painkillers and anti-sickness medication will be available if you need them. You can occasionally have bruises to your lips and tongue, and rarely you may suffer a dental injury. The general anaesthetic will be given into your drip. As you fall asleep, you will feel pressure on your neck, and this is to protect your lungs. It is uncommon to feel or hear anything after that. You will wake up in the recovery room and can see your baby as soon as you are awake. I hope this has been useful to you and helped you to feel more prepared for your caesarean section. However, please feel free to ask the midwife, anaesthetist or obstetrician looking after you any questions you may have.